Hey everyone, this is Arturo Hill, and this is the Real Talk Podcast. Today, we're interviewing Dr. Copland via Zoom. We're shaking things up a little bit. I hope you enjoy. Welcome to the Real Talk Podcast. Today we have a special guest, Miss Ebony Copland. She's a doctor. She works at Howard University. She's going to give us a lot of great insight into this important topic about provider stigma and how we can help combat provider stigma. So that way we can dispel medical mistrust and everything. But before I begin, I want to do a brief introduction to her and her accomplishments so far. So Miss Ebony Copland has an MD. The MPH serves as director of Howard University Student Health Center and assistant professor in the Department of Community and Family Medicine within the College of Medicine. Dr. Copland is fellowship trained in adolescent medicine and completed her residency in family medicine in Chicago. Prior to her residency, she attended medical school at the University of Kansas. She earned a Master of Public Health degree from Virginia Commonwealth University and her bachelor degree from Hampton University. Dr. Copland's background includes extensive work in community reproductive healthcare and bringing awareness to health disparities. Previously, Dr. Copland served as Director of Adolescent Medicine at Morris Heights Health Center in the Bronx, New York. Thank you so much, Dr. Copland.
Thank you, Arturo. Happy to be here.
Awesome. So before we begin, so the topic tonight is going to basically be about provider stigma, as I once said. But before we get into all of that, I would like to just ask you a fun little question. So what is your favorite holiday, and do you have any particular traditions that you do on that holiday?
Okay, what is my favorite holiday? I think my favorite holiday is Halloween.
All
Um,
right.
and I think part of the reason that is one of my favorite holidays is because I've lived in cities where Halloween is a really big deal. So Chicago, Halloween was a massive celebration. New York, Halloween is a massive celebration where adults, it's just as much for adults as it is for children. So I really enjoy Halloween. I really enjoy watching people get dressed up and really express their creative juices and make amazing costumes. And I've always had friends who are extremely creative in their costume thoughts and designs. They put a lot of time and effort into it. So I really like Halloween.
Oh yeah, it's a fun night. People get to design, look great. You know, the fashionista in me loves Halloween, definitely. A first question I would like to ask you is, what inspired you to get into the field and become a medical provider?
I always wanted to be a medical provider. When I was little, I thought that girls were nurses and men were doctors, or however it worked. And then once I found out that women could be doctors too, that was pretty much a wrap. So that was like, well, that's what I want to do. I always wanted to help people. My like kindergarten or I think it was my kindergarten or first grade. Um, Yearbooks, it has that I wanted to be a nurse or a doctor. So I think I always was really drawn to the idea of helping people.
Awesome. That's really good. You know, this is definitely a rewarding field, and it's great that, you know, you are helping, especially as you address, you know, being a woman in the field, showing that more women can be in the field and relate to people. So, when it comes to health disparities, do you see any health disparities in the communities that you serve?
Absolutely. I think that the I can't imagine that anybody is being honest if they don't acknowledge that health disparities exist. And not necessarily directly related to medicine, but because of institutional racism that exists in every aspect of our society, that contribute to those disparities, right? So um, if you don't have access to grocery stores, you don't have access to groceries, you don't have access to fresh produce, you don't have access to good meat, so you're going to eat poorly. And what does eating poorly do? It puts you at risk for all types of health conditions, diabetes, hypertension, heart disease, high cholesterol. And so disparities, even let's say all things were created equal in healthcare, which they are not, the disparities that exist within society are going to contribute to our outcomes to begin with. There's data that talks about asthma and how it's related to urban environments and exposure to certain bugs and things of that nature. So, it just absolutely disparities exist for a multitude of reasons.
Yeah, no, that is very true. Just the intersection of being Black, being young, being male, being woman. One of the examples I would say that I've seen in DC, um, of certain communities trying to map like Anacostia, like kind of in like little, I guess downtown Anacostia. How now they used to have a Whitman Walker there. I know the Whitman Walker moved to a different location, but they have a church, they have a patient first. You know in certain areas, I definitely do think it's important to, if these areas, like you said, have higher propensity to health disparities, we should be building more things and stuff, and how gentrification, all this stuff comes about when people move or, push out. But while the
Right,
people are in the
right,
areas, we should have these institutions, so that way
right.
you feel sick, you can run straight to the doctor.
We should have had all of them, right? So
Yeah.
nice parks, places where people can actually exercise and
Yeah.
play and do all of those things, all the things that contribute to good health. You have left communities totally marginalized from those amenities, right? And so it's been okay for these communities to not have access to groceries, not have access to safe outdoor spaces, not have access to bike lanes. Like you can still see this difference in bike lanes in various parts of the District of Columbia compared to others, right? And
Yeah.
so it's like the people who are riding, in certain parks, they're making it, and people have always ridden bikes, but it's definitely much safer, and there's been access created in other areas well before some parts that are still left without. And like
Oh,
you said, there's definitely, I have a colleague, she lives in Southeast and she goes to Maryland to go to the grocery store. It's not super far, but she shouldn't have to do that when
yeah.
there are other areas, the District of Columbia, that have somebody just goes downstairs to their Whole Foods, or, across the street to the grocery store. There are a couple grocery stores, Trader Joe's, a Whole Foods, and a Giant. And yet there are some communities that there's no grocery
It's a
store.
desert. It's a complete
Yeah,
desert.
complete
Yeah,
desert. Yeah.
it's crazy. Before I go to the next question, I recently went to a meeting and they were talking about HIV disparities, and how in DC the HIV numbers have reduced since, I believe it's 2022 or 2021, from 13,000 to 11,000. But they chalked that up to be because 2,000 people moved, and where they're moving to, like you said, Maryland, outskirts of Northern Virginia. So it's not really solving the problems. It's just kind of pushing the problems to other areas. And, the transition is hard because if they don't have like residency in these areas, can they really access healthcare, in the areas that they move, or they have to take a long time, to transfer tri-state.
Right.
It's a lot. So another question is, well, I would say, do you feel that medical providers have a hand in stigma? We face a lot of stigma just, with TV, stereotypes, but do you feel like people, well, not people, but the institution of providers sometimes reinforce stigma like HIV or other health disparities to clients?
Yeah, absolutely. I mean, I think that providers are humans. We all have bias, right? We all are um prey to, having our prejudices and whatever stigmas come with certain things, and some stigmas have stick, right? And I definitely think that there's stigma still related to HIV for providers that are unfamiliar with treating it. I think that people who have grown up in urban places and spaces, and those cities like DC, like New York, where HIV is never, is always ever present. You have providers that are much more at least aware, even if peripherally, right? But there are lots of providers that aren't in urban cores and places and spaces. And so they are not up to date with the progression of HIV and treatment of HIV and what the face of an HIV patient may or may not look like in 2024, right? And so I definitely think that people, even people who work in HIV, I think that they overestimate the lack of stigma, right? People who've been working in the field and dealing with this, for the last 20, 30 years, or even, if you deal with it every day, you're talking to people who understand and know. You're talking to patients who have it, who live normal lives. You're talking, to you, it's like, no, we've been past this. What? I mean, the medicine is the size of a Tic Tac, blah, 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 right? But I think the general public, everything is still highly stigmatized, right?
Yeah.
It's still stigmatized within the community of people who have HIV. It's still stigmatized among the LGBTQ community. Like you would think, you'd like, no, it's not. It is. So the stigma still definitively exists in every aspect, from providers to, the general public, to people who are participating in high risk behaviors, right? So it has not gone away. And I think sometimes people who work in the field are just so far removed from that they don't realize that, like, people are still very prejudiced against everyone. You know what I mean? Like, all the prejudice that have ever still exist in large quantities, right? And now we're in a society where people feel more empowered to express their disdain for that. It used to be politically incorrect to be racist or prejudiced against, LGBTQI community. But now, you have a whole set of community that supports that type of rhetoric and behavior. So not only does it exist, but it's actually, in my opinion, been magnified, and people have been given with what would be considered, politically incorrect views of a voice and many avenues to express those stereotypes and damaging language that perpetuates stigma.
Yeah, this a lot of online, certain communities now, like you said, they have pulpit now to kind of spew and influence people in negative ways. What I was gonna also ask is, so as serving on Howard University, how does Howard University address provider stigma or just health disparities for their students and also for the community? Because it's not just Howard, it's also the community around Howard.
Yeah, I mean, I think Howard tries to stay on the forefront with regards to research related to people of color. Howard is one of the few Black medical institutions, right? And so the research that's done here by these people is looking at specifically people of color, people that look like you and I, and how our health is impacted by a variety of things. And so constantly being left out of research is one of the things that also contributes to disparities, right? They just recently, there's been conversation about one of the indicators for kidney failure. We've known for years that it was not effective or accurate for African Americans, and we've continued to use it. Right? Like, because that's the test that we use. We also know that BMI is not quite as accurate depending on body shape, right? Because centripetal or stomach adipose tissue is the high risk, is where your most highest risk fat is, right? And so people who are more bottom heavy or whatever, the risk levels may not be quite the same as somebody who has a big gut, right? And there are definitive differences in body types by ethnicity and race, right? So we lack of research and us not being included in research contributes to guidelines that aren't serving our needs or are not adequately meeting our needs. And so, you know, that is one of the major contributions that Howard makes to medicine, is that it's doing the research in ways that really can have an impact on the longevity of medicine in taking better care of people of color. And then in addition to that, I mean, by producing doctors of color, the data shows that people have better outcomes when they have doctors that they relate to, that look like them, that have ethnic similarities. And so by being one of the number one producers of providers of color, that in and of itself, it helps to establish disparities. And then specifically now with the changes with the Supreme Court with affirmative action, institutions like Howard University and Morehouse become even more critical because, you know, the schools, there are going to be schools that were, you know, taking students that don't feel the same level of obligation or pressure to do that now.
Yeah, no, that's very true. And so thank you so much for all of the insight. You even gave some information that I'm gonna take back, you know, with the gut health and the fat. I didn't even know about that myself. So that stuff I'm gonna take back and start thinking of, because these are simple things that a lot of us don't even think about, you know, and because of, like you said, us not being a part of certain spaces, us being left out, or they still going by old school rules or old school trials that they did back in the day and not really updating and having nuance. It does leave us, you know, and leave us out in a lot of ways. So I wanted you to end everything off with a final thought. If you have anything, you know, you would like to close with, or any advice, or, you know, just any insight. Further
Um,
insight.
I think that I did another interview recently, and one of the things I encourage people to do is really be advocates for their own healthcare. You know, we don't live in a time and space now where you're stuck with a doctor one doctor on your insurance. You know, I think that being comfortable with the medical care that you're receiving, whether that's your primary care, your you know, obstetric and gynecology care if you're female, your reproductive health care if you're going to like STI clinics. I think that having good relationships with your medical care team is critical to engaging in healthcare in a way that's going to be beneficial to you in the long run. If you trust your doctor and your doctor tells you this, then you're more likely to hear it, receive it, and attempt to make the necessary changes. There's a warranted mistrust of the medical institution that Black people have, and they should, because while you want people to listen to the medical advice, the distrust of the medical institution is very much historically warranted and appropriate. There's implicit bias that exists that is still impacting care. There's just historical context that still plays out in the way people of color receive their healthcare on a daily basis. So I do think that it's important that you figure out and take the time to find a provider that you really trust, and that so that when they give you the information that you need to be as healthy as possible, you believe them. And if it's somebody where you're like, he barely talks to me, or da 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 da, and you know, I said this previously, ideally the data shows that you'll have better care with providers that look like you. However, and we're in the DMV, people have the luxury of being able to find that in a lot of spaces
Yeah.
that many places don't have. So I do think people in the DMV should use that as their take advantage of the fact that there are lots of providers of color, but that doesn't have to be the only criteria. At the end of the day, it needs to be a provider where when you all have a conversation, you feel like they are trying to take care of you and that they have your best health interest at heart. So I really think that that's what's important, that you do trust your provider. And if you don't, find another provider. Do the work to try to get yourself with a medical care team that you all can work together to make sure you have optimal health.
Oh yes, that's very true. So, you know, what I would say is that, you're saying it's kind of like a tango. It takes two. So definitely on us as the medical field to meet the needs of our clients, to exhaust all efforts, to update, to take critique, to have nuance, to provide spaces people and also be alert to, like you said, the changes in how students access colleges now and really stay on the heels of what's going on in current times. But also as the providers, oh, not providers, but as the clients as well, to, take control of their autonomy, also to voice, their to voice their concerns and to also advocate for themselves and to go where they're celebrated, where they have a good relationship with their.
Yeah,
So
and
yeah,
I'm not putting the onus on the client.
yes,
I
yes.
am, we as providers went into a profession where it is our expectation to stay up to date, right? Like we need to know what's happening. We need to be able to provide the best, most accurate, least harmful care out there. And so it's definitely our jobs to do that to the best of our abilities. And that's what we should be doing. But I think if you feel like that's not what's happening or that's not what you're getting, then we used to live in a time where it's like, this is your doctor, this is the doctor, like this is it, you have to deal with him or her no matter what. And now people do have choices. There's lots of entities, there's lots of clinics, there's lots of places where people can get their care, and so they should exercise that.
Oh yeah, definitely. Sometimes patients don't even know that they have the power to say no or to say, hey, stop this or don't do that or ask
Right.
more questions and
Ask more
things.
questions. Right.
Yeah.
Ask more questions. Yeah.
So, mhm.
It's
So it's
shocking.
yeah,
They come home and they're like, this is what the doctor said. And then it's like, well, did you, I even have friends that are non-medical and I'm like, did you ask them that, and no, they didn't.
yeah. So,
So,
it's about us as patients knowing our own power and stuff. And I think that's a very empowering message that you've given. So, Dr. Copeland, I once again want to thank you so much for taking time out of your day to have this interview. I really think people who are watching this are going to have a wealth of knowledge because you gave us a lot of great gems that we're definitely all, including myself, are going to think of, especially when I go to my doctor, because I'm gonna be like, doctor, make sure I got the check that out, please, because all the stuff we got in our food today, that's a whole nother story. So, so I would like to conclude this interview and thank you so much.
hi, I'm Dr. Ebony Copland, and you are watching the Real Talk podcast.